Welcome back to Breakfast Central. Now, we know that most of you have in your homes, houses, offices, and cars expressed your undivided opinion about the current insecurity that is hitting close to home. For some of you, your mental health is at stake. For many of us, actually, that is. Thoughts of, what if it was my daughter, son, or even child creeps into your mind once in a while? What would you do? Some of you have expressed and echoed sentiment made by a few. If I had known, I would have relocated to this place and that place.
Now, all this lead to one thing, and it is your mental health. Managing anxiety can be difficult and not so easy for some, and health implications could also rise with the recent cost of inflation, insecurity, and bad news. Actually, the bad news part, you can date it back to the last 30 years. Our guest today is a psychiatrist and lecturer who will share ways in which you can manage the complexity of mental health challenges. Welcome to the show, Dr. Abiri.
Thank you very much. Thank you for having me
Thanks
here.
for joining us.
Thank you very much for joining us.
I was saying earlier that I've done broadcast media broadcast journalism for about 13 years, and I don't remember the last time that we had like 3 days back-to-back good news in Nigeria. It's been pretty chaotic. Do you think I'm okay? Do I need help?
All right. Thank you for asking. I think that it's important that people realize that adversity is a part of life. And so you've said 3 days back to back. Yes, adversity is a part of life. It can't always be good news all the time. It's like our emotions. We can't always be happy all the time. So sometimes you're angry, sometimes you're happy, sometimes, the mood fluctuates from sadness to envy to jealousy to happiness back again. So adversity is a part of life. And it's also one of the things, if we are able to cope and how well we are able to cope with adversity, that would say whether or not we're in a good state of mental health. So once in a while, challenges will come. Life will throw us curveballs. How well we're able to rise up, learn about it, and forge ahead in spite of the adversity is what makes us who we are. So
it feels like Nigeria has been like adversity, like
back to back. It's almost like no break. And in this year, if we look at this year alone, right, from December, let's go back to December. It's been back-to-back news, negative news, from the accidental bombings to the killings in Plateau on the eve of Christmas. And this year, even as recent as yesterday, there was a bomb explosion. We don't know the actual state of the casualties that have emerged from that. In this season, how can people better protect their minds and their mental health? I know one thing they say is shut out the news and shut out the, all that. But for people like us, so you're going to address generally, and then for people like us that deliver the news, we can't shut out the news. How do we handle it?
Well, I think that what has happened is, again, it's not like good things don't show up every once in a while, but when you have bad news is more likely to spread like wildfire, is more likely to get more attention than good news will get. And so what is it rather that we can do as a people and as a nation as well? We must be aware. Like I said, adversity is part of life. It's not something that we like to hear. We don't like to hear that bad news is going to show up, something bad might happen, but it just might happen. And the more we are aware, very important, the more we are informed. So beyond being aware, get information and get information from the right news sources. So yes, News Central. Let people listen to the news, get the news. When you're also consuming the news, you also need to, identify how it is that you are around the news. I'll give an example. A few years ago, I would wake up in the middle of the night. Maybe my husband was playing his PlayStation and I was hearing adventure games. And I'll just tell him, I'll say, you see, in my dreams, I was in Zambisa forest. I don't know, I've never even been to Borno State, but we can become what we consume. So people also need to be very careful about what it is that they consume. Identify how it makes you feel. Identify, what feelings and emotions and behavior that happen when you take in a lot of news. And of course, be able to filter what it is that you need. Sometimes, yes, shut out the news. Also, come to that reality that I am not what I hear. I am not, the adversity, the difficulty around me. It may be difficult to process over a while, but coming to that reality. But then most importantly, I think one of the things that we must do to be able to ensure that we remain in, optimal mental health at all times is that we must learn how to cope. Coping with adversity. People cope. Drinking alcohol is coping. Taking substances of abuse is coping, but it's unhealthy and maladaptive. And so we must start to look for healthy ways to cope. Talk to a trusted friend, a trusted individual. Speak to a professional. Read about what is going on. Inform yourself. And then find things around you, that make you happy. Is it exercise? Is it music? Is it, journaling? Find healthy ways of coping amidst all the, madness that just might be going on.
I like the part where you said, people should say to themselves, I am not, what I hear. this is not my account balance, you know, that word also.
I can't help you with that, sir.
But I want to ask, right, on a more serious note. So we talk about the effects of, you know, poor mental health or failing mental health, you know, across the society. Which of them would you say it is for Nigeria? South Africa, for example, has seemingly disturbing suicide rates, right? Nigeria doesn't have the same thing. So is it because we do not have proper records for, you know, suicide, or do Nigerians, is there a way that, you know, our mental health, you know, affects us, you know, that it's not necessarily suicide, but it's also affecting us in a way that is almost as dangerous as people committing suicide in Nigeria?
Well, so again, you know, people often have always referred to us as the happiest people in the world. But with all the Shege Pro Max and Shege Banza that is going on, people are, you know, having to rethink about all of that. Suicides happen. They're just very underreported. And because of the stigma and discrimination that come with not just mental health issues, but suicides as well.
Yeah.
How many people in their families do you think will come out to say that this is the cause of death of a loved one? People would rather just say, you know what, give us time, let us, you know,
Process
this as a family. We would appreciate all of the privacy. So suicides happen. I'm a mental health physician. I've lost patients to suicide, painfully so. I've heard that people have taken their lives by suicide. So it's not like it's not happening. People are not just, you know, ready to share that this is what it is that happened. So
Wow.
Suicides happen. It's not just South Africa. We have, you know, the barrage of mental health conditions, from anxiety disorders to depression to psychotic disorders to even substance abuse problems. Self-harm. People are self-harming. And of course, suicides.
Really underreported.
Yes, really underreported. Really underreported.
All right. So let's talk about how important it is for people to access mental health facilities. First of all, how readily available is it? The Federal Neuropsychiatric Hospital in Lagos, you know, I don't know how great the services are there, but there are many people who wouldn't want to outrightly go there because of the stigma that's been attached to Yaba Left. So how readily accessible are, you know, mental health supports and how financially affordable is it?
All right, so health is available. Help is available. Again, we go back to stigma and discrimination, the culture and our religion. More often than not, people are more likely to go to religious bodies to seek help. You know, I'd rather call my pastor, I'd rather call my imam, or they'll tell you that there's one mountain somewhere where unfortunately people are tied down in chains, beaten, sometimes raped, and, you know, sometimes made to face very difficult situations. The hospitals are available. I had my residency training at the Federal Neuropsychiatric Hospital, Yaba. It may not be, you know, a 7-star hotel or anything, but the expertise is there, the resources are there, the facilities are there. I know that quite a number of people may not also want to go that way because of, again, stigma and discrimination. And unfortunately, a lot of this stigma can be self-foiled. It's, you know, people telling themselves,
What will people say?
Yeah, what will people say? How will they look at me? How, you know? However, beyond the Federal Neuropsychiatric Hospital, the Lagos State as well, you know, there's lawsuits, and the Lagos State has also made an attempt to ensure that most of the primary healthcare centers also are able to respond. And then, of course, there's quite a number of, you know, private mental health facilities. I won't lie to you, health is expensive. And to be able to access the care that people need, sometimes it comes with a lot of funding. It's also very important at this point that I state that beyond the care that people will get is the expertise available. Again, you talked about Japa this morning. We're losing quite a lot of our best hands. At some point, we used to say that there were 200 psychiatrists to 200 and counting million, you know, Nigerians. That number is dropping by the day. Either people are leaving or we're losing people, you know, to the cold hands of death. So help is available. And of course, I always encourage that people are aware, informed. You see, when people have information, they're more likely to be able to take more informed decisions about their health, such that we're not waiting for them at the end of the line. We're giving them the information on how best it is that you can cope with whatever it is that is triggering or bothering you so that you can be in optimal mental health.
Okay. Yeah. So, I mean, I just wanted you to give us a practical exercise maybe that the average person can practice in the moment where they're feeling overwhelming anxiety. Many people actually are battling anxiety. Some just don't know that it's anxiety that they're battling. So there's been bad news. There's been the case, unfortunately, of Nabiha. I will come back to that to ask you how, you know, the government can ensure that we can provide support for them. But for the average individual who's battling anxiety, depression, are there practical exercises that you can give to help?
All right. So again, before I answer that question, I'll tell you that anxiety is a normal response to a threat. Whenever you think about a threat, or will there be traffic? What will happen at work today? You can become anxious. However, when the feeling or the emotion continues to stay, despite the fact that the threat has been removed, an anxiety disorder can happen. And so, yes, you're right. Anxiety, quite a number of people have anxiety. Anxiety is one of the commonest mental health disorders. And so how can people cope? There's a technique that is known as dropping the anchor. And so whenever a ship is at, on sail and, there's a bit of turbulence, what does he do? Sometimes he drops the anchor to steal it. And so how can we as individuals drop our anchor whenever we're faced with difficult or turbulent circumstances or situations? The first thing is that you use the ACE, A-C-E. Acknowledge what you're going through. Don't fight it. The more you fight it, the more you struggle and you suffer. So acknowledge what you're going through. What's going on with me? This is how I'm feeling. I'm not feeling quite, myself. I feel sad. Be in tune with your emotions. So acknowledge what it is that you're doing or what you're going through. The C encourages that you come back into your body. And so instead of trying to escape, which is what, anxiety will do, the fight or flight or flee or freeze response, come back into your body. Tell yourself, my hand is on the other hand. I am sitting somewhere. I am wearing a blue dress. You're beginning to call your senses that what exactly is going on? Where am I? What am I doing? Who am I? And the last thing is to engage your senses. We say that engage your senses is what is known as the 5-4-3-2-1. So the sense of sight. What are 5 things I can see around me? The sense of hearing. What are 4 things that I can hear? You can hear my voice, probably the AC, a few things. 3. What are 3 things that I can feel right now? I can feel my buttocks on the chair. I can feel that my legs are in my, shoes. I can feel my hands. Then you look around you and then tell yourself 2 things that I can smell. Perhaps my perfume, perhaps the environment. And the last one thing that I can taste. It can be your saliva. It can be the last thing that you ate. But you see, dropping that anchor, it's a mindfulness-based exercise that allows you to be in touch with reality, be in the moment, not to judge what is going on, but also steals you from time to time. Again, it's not just one-off. The more you do it, the better you become at it, but the more that it helps you to be in tune and in touch with yourself.
Do you do this before you, or after you enter the house where your wife is waiting for you?
I knew he was about to say something silly.
Because if it's your wife that is scaring you,
Well,
you do it before you enter the house or when you've dealt with the situation and you come outside. And then you acknowledge.
Let's take it like a medicine. You can do it when you wake up in the morning. You can do it in the middle of work, whenever things are upsetting or ruffling you. You can do it just before you come into the house. You can do it just before you head on into traffic and before you go to bed.
Sort of steal yourself.
Yes, just steal yourself.
On a lighter note.
Okay.
Yeah.
So now
I did speak
go ahead.
earlier. Apologies. I did speak earlier about trauma for people in northern Nigeria who have dealt with like 2 decades now of terrorism and banditry and some of the most gruesome deaths that they've ever experienced. And I was saying earlier that I don't know that they would ever be able to heal. Those are lives that have been torn to shreds by these things. What would you say to those people? And is there any healing that they would ever be able to experience? Or are we as a country just going to accept that, damage has been done and that's it?
Well, it's so unfortunate, but that's our reality. They are the unfortunate direct recipients of trauma. The rest of us are also traumatized. I mean, see me sleeping in my house, God knows how many miles away, and dreaming about Zambisa forest that I've never been to. Yeah. But let me not use that response to invalidate what it is that they're going through. It's rather unfortunate. Sometimes I sit in my house and I hear a plane and I'm thinking somebody somewhere is hearing a plane and the next thing that they're expecting is an explosion. It's difficult to say that will they ever heal, especially because healing is not a destination, it's a journey. Yeah. And then we talk about trauma. Trauma is when you are, overwhelmed with something that is threatening to your safety, your stability, your sanity, and your sense of security. There's also something known as a process trauma and an event trauma. An event trauma is, it happens and then it stops. I was robbed and they never came again. But a process trauma, these people, unfortunately, are continually faced with different types of trauma on a daily basis. This morning, they don't know what will come. They haven't dealt with yesterday's own. So they are unfortunately at risk for a plethora of many mental health disorders, from anxiety to depression, to substance abuse, to psychosis. How can we help them? It's hard. Again, the resources to support them where it is that they live are limited. So it's a difficult one. It's not something that, we can just say one of it. You can't be telling them drop anchor. Yeah, they can use all of these things every once in a while, but you see, they need support. They need resources in terms of people, in terms of probably, you know, so we talk about support, emotional support, financial support, psychological support. But whatever it is that they're going through must never be dismissed. We must give it all the attention that it deserves.
Yeah.
All right, Dr. Bonjubola Abiri, thank you so much for joining us. There's so many things that we need to talk. We hope that we can have you again. Mental health is an ongoing conversation. I don't think we can ever exhaust the areas that need to be focused on.